Welcome to today's explainer. We are jumping right into a step-by-step blueprint for totally revitalizing your scalp and hair health. We're talking about the Dr. Groot's 30-day hair care plan. Look, if you've been frustrated by routines that promise the absolute world but deliver, well, next to nothing, you are going to want to hear this. We're going to break down exactly how this clinically tested system works day by day to completely transform your hair's foundation.
Get this. A staggering 85% of men experience some level of hair thinning in their lifetime. And it's definitely not just guys. Studies suggest up to 40% of women deal with this too. It is incredibly common. But here's the crazy part. Despite millions of us dealing with shedding or thinning, most of us are tackling the problem entirely wrong. We're treating the symptoms and completely ignoring the actual root cause.
Okay, let's dive into this. Most people focus practically all their energy on conditioning the ends of their hair and protecting the length. But think about it like this. Healthy hair is exactly like a house. It absolutely needs a strong foundation to thrive. And your foundation? That's your scalp. Optimizing that scalp environment, right where the follicles are physically embedded, is the entire core philosophy of the Dr. Groot system. Healthy hair simply has to start at the scalp.
So here is our 30-day roadmap. We'll start with the root of the problem, look at the clinical evidence, dive into building the foundation in weeks 1 and 2, move on to activation in weeks 3 and 4, and wrap up with daily habits to accelerate your results.
Part 1. The root of the problem.
You really have to rethink everything you know about your shower routine. We need to talk about scalp optimization. Basically, this is the process of clearing out buildup, balancing your moisture levels, and reducing inflammation right at the follicle level. Why is this such a big deal? Because if your scalp environment is constantly clogged up or chronically inflamed, applying some ridiculously expensive serum to the ends of your hair is literally never going to move the needle. You have to optimize the environment first so your hair can actually grow thicker and stronger naturally.
Now, what's really interesting about this next slide is the science backing it up. Part 2. The clinical evidence.
82.2%. In a 2-week dermatologist-tested clinical study of 24 subjects using the full Dr. Groot system daily, participants saw a jaw-dropping 82.2% reduction in hair loss due to breakage. Just let that sink in for a second. That is a massive reduction, and it happened in just 2 weeks of use.
But the data goes even deeper. In a separate study of 22 subjects using just the shampoo and the Miracle In-Shower treatment together, they recorded a 169% increase in scalp moisture, plus a 76% removal of the stubborn buildup that aggressively clogs up scalp pores. And remarkably, 100% of the subjects showed measurable improvement in visible scalp redness from dry skin. Literally every single person in the trial. These aren't just fluffy marketing claims. These are quantified outcomes proving that the system actually hydrates, cleanses, and soothes.
All right, part 3, weeks 1 and 2, the foundation.
Let's get into the instructional side of phase 1. You're going to aim for 3 to 4 wash days a week. First, wet your hair and scalp really thoroughly with warm water. Second, apply the Hair Thickening Shampoo directly to your scalp, not just the lengths, the scalp, and massage it in using circular motions. Remember, massaging isn't just about getting clean. It actively stimulates blood flow straight to the follicles. Third, follow that up immediately with the Miracle In-Shower treatment. Apply it to the scalp and mid-lengths, leave it to do its thing for 2 to 3 minutes, and then rinse. Finally, pat your hair dry. No aggressive towel rubbing, okay?
Setting expectations here is absolutely crucial so you know what's happening. On day 1, your scalp is going to feel noticeably cleaner and just lighter. By days 3 through 5, you'll likely notice a real drop in any itchiness or greasiness. And then, week 2 is where a major shift happens. Your scalp moisture actually stabilizes. This is exactly when the prebiotic complex in the shampoo starts really nourishing those follicles. And you'll find your hair starts feeling significantly softer and way more manageable.
Moving right along to part 4, weeks 3 and 4, the activation. Now we build on that perfectly clean foundation to target the thinning areas. After every wash during this phase, you're going to use the Hair Thickening Roll-On Serum on towel-dried hair. First, section your hair to really expose the scalp, especially around your crown or hairline. Next, roll the serum directly onto the scalp. So the crucial point is that you have to use the metal tip to apply it right onto the root environment. Then, just massage it in gently with your fingertips. And whatever you do, do not rinse it out. Leave it in so it can fully absorb.
Let's trace how this builds up. At the start of week 3, you should start seeing a real, noticeable reduction in how much hair you're losing in the shower. By the end of week 3, you'll realize the serum is doing its job. With zero greasiness, it's an incredibly lightweight formula. And then comes week 4. This is the magic window. This is where visible thickening starts becoming apparent right at the roots, and your overall hair texture is going to feel much stronger and far more resilient.
So why does this activation phase actually work? Well, it all comes down to the science of the active ingredients. You've got niacinamide, which improves scalp circulation and builds up a stronger skin barrier. Then there's caffeine. This is super fascinating. Studies suggest caffeine actually keeps the follicles in the active growth phase for a longer period of time. Basically, less resting, more growing. And finally, menthol. It provides this great cooling sensation, which is actually your physical indicator that the product is absorbing deep down to stimulate those dermal papilla cells.
Part 5. Accelerate with daily habits.
The Dr. Groot system does the heavy lifting, for sure. But your daily habits, those act as massive multipliers to compound your results. First up, swap your pillowcase. Sleep on silk or satin. Standard cotton creates overnight friction that causes breakage, which is the exact thing we are trying to stop. Second, keep your hot styling tools under 180 degrees Celsius or 356 degrees Fahrenheit. Less thermal stress simply equals less breakage. Third, grab a silicone brush and massage your scalp for 3 to 5 minutes every day, even when you aren't washing it. Keep stimulating those cells. And finally, track your shedding. Clean out your hairbrush before day 1 and check it again after day 30. Seeing the visual evidence is incredibly motivating.
And this brilliantly illustrates who this system is really built for. Because the formula is totally free from parabens, sulfates, and silicones, it utilizes prebiotics and biotin for all hair textures. Plus, it's completely safe for color-treated hair. It is a real game changer for anyone with thin or fine hair, folks dealing with post-stress shedding, anyone with a dry or sensitive scalp prone to flakes, or if you're just trying to transition away from harsh, silicone-heavy products.
I want to read a quick quote directly from the source material because it honestly hits the nail on the head for our entire explainer today. Quote, "The shampoo, treatment, and serum aren't designed to work in isolation. They build on each other, creating an actual hair care system." End quote. Isolated products almost always fail. It's the consistent daily use of a unified, 3-part system that's going to deliver the kind of measurable success we saw in those clinical trials.
So the only question left is, are you ready to start your 30 days? You've got the exact step-by-step blueprint, you've seen the clinical backing, and you know the daily habits needed to optimize your foundation. Go clean your brush, start tracking your progress, and take action. What could your scalp health look like just 1 month from today?